So I love golf, as we've covered, and the courses are teeming with players right now. A lot of people might be so excited to be out on the links that they may overdo it a bit. And that's when you feel it. Some soreness, a pangs, stiffness. Our sponsor, the Core Institute, can help you recover from those aches and pains. And we are joined by Dr. Jeffery Michaelson. Dr. Jeff, what's going on?
Good morning. Thanks for having me, Jason. Appreciate it.
Good stuff. I mean, I'm sore today because I was at a lesson on Monday, or I'm sorry, on Tuesday. So the dreaded 2 days later kicked in, and my lower back is sore, my hips are stiff. What can I do about it?
All right. So, well, let's kind of talk about that a little bit. Was this I haven't played in a while type thing, or is this more of a I am changing my swing around thing?
In full honesty, I have a pinched nerve between L5 and S1, and then pre-arthritic hips, according to my doctor. So I'm a mess. Can you help me?
So, all right, let's kind of talk about let's talk about some warm-up stuff first then, before you go out, so we can maybe minimize some of those things. So, okay. What we like to say in orthopedics is it's kind of about going from short to long when you're doing your warm-up. So I think it's a little counterintuitive to people, because most of us will go out, take 3 or 4 swings, and then head out to the first tee. I really like to try and counsel my patients that you start short, meaning you start out on the putting green, you work to the small game, kind of go do some putting into the pitching, and then from pitching, go out to the range, try and get some of your mid-irons, kind of working from short to long, then your hybrids, and then the last thing you really want to take out is your driver, so you get the chance of going right from the driver, nice long swing, nice long arc of motion, so your back is nice and loose, and then at that point, I think you're safe to kind of walk right out to the first tee.
Dr. Jeff, tell us what the Core Institute is all about.
All right, so the Core Institute is it's an orthopedic and pain and spine practice. We have offices all over the city, and we pretty much have specialists who can take care of you from at least from head to toe, back, shoulder, knee, hip, ankle, foot, you name it, we got it for you. And yeah.
So what is the difference between typical soreness and what would constitute an actual injury?
So, right. I think for those of us who grew up with sports, it was always kind of the are you hurt or are you injured kind of thing. So what I like to say is I think of in terms of 2 ways. If it's an acute injury, and by that I mean it's you remember getting hurt, you remember the day you got hurt, the moment it happened, then to me that's the thing that I'm going to want to pay attention to. So in golf, golf is a physical sport. It's not football where it's contact, but it's just as physical, especially with the rotation and the pulling and the pull of the arms. I think the most important thing is if you feel like you had an acute injury, you give it a day or so, you do the traditional rest, ice compression, elevation, and you still feel like it's a problem, then we want to see you at one of our orthopedic offices and we want to get you checked out.
What do you recommend to get conditioned to play?
So, I think in the off season is where it starts. Thankfully, the weather is breaking and we're all going to get to be back outside now. I like to think in terms of 3 components of any health. And so my mantra with all patients, and I think our practice is the same, is there's really 3 components to good health. There is the balance, there's strength, and then there's cardiovascular. So for golf specifically, where it's a little bit less cardiovascular, but it's a lot of balance and a lot of flexibility and strength, I like to see my folks doing a lot of stretching, especially around their hamstrings and their back. I like them using some what we call sleeper stretches, where we're working on kind of trying to get the back of the shoulder loosened up, because the tendency is that we don't have that balanced back swing to forward swing. And so when that happens, there's a tendency for us to try and over pull with our shoulder, especially our lead arm. And those are the things where I like to see us kind of really working on flexibility and stretching, and then strengthening. Doesn't mean you're going to be at the weight room, doesn't mean you're doing a lot of weights. But I think that the best program really is one where we're working on more repetitions, lots of flexibility, because that's going to increase that arc of motion for the golf swing, and that's going to get you better distance and hopefully get rid of a slice.
I remember distinctly one day 25 years ago showing up at the course as a twosome with my buddy. We were 25 years old. There was a bunch of old guys doing all their stretches and warming up. And, hey, do you mind if we play through? No, go ahead. We were cackling all the way down the fairway about the old guys back on the tee. Still, we're out there playing golf and they're stretching. I'd like to knock myself upside the head for thinking that I could get away with that forever. Where are you located?
So we have offices in 3 places. Our offices are in Southfield and Novi and Brighton. We make sure that we have visits available every day so that we have our athletes can be seen same day, next day. And we really make sure that we have somebody always in the office every day so that so people feel like they can get seen, especially as the weather's getting nice and the golf season's upon us. We know that there's going to be some new things that people are worried about, and that's exactly what we'd love to see.
Dr. Jeff, it's been a pleasure. Thank you.
Jason, thanks for having me this morning. I really appreciate it.
Absolutely. To learn more about everything the Core Institute offers and to schedule your appointment, visit the website, thecoreinstitute.com. Again, that is thecoreinstitute.com.